here we're talking abuse deterrent formulation, or ADF, opioid medications. Not necessarily always just opioid medications, but the different manners of preventing someone from transgressing to the inhalation or snorting of medications, or even intravenous use injecting. Whether that's a psychological thing or the actual not wanting to inject, that's for conversation. But there's the different manners getting to that point there for how these products are actually working. They could be, one would be something like aversion, where if someone were to attempt to abuse the product, it would just not feel good. For instance, there's products where if you were to crush the product and then attempt to snort it, your nose isn't going to feel good. It's going to feel very bad, actually. So it would deter someone from doing that again. There's products that include things like opioid antagonists in there to just, if someone utilizes the medication as intended, the day is good. The medication will be expected to work. But if it's abused, misused, crushed, whatever, you're going to activate that second medication in there, and that would be the one that would actually just block everything, possibly even going down the road of withdrawal and whatnot if enough as well. You combine things like that along with the what I would commonly say is things like potato battery chemistry, very basic chemistry, utilized in a very strategic and intelligent way to make it where there's coatings. The medicines aren't activated, are not absorbed in the stomach, in the GI tract until a specific point. Things like pH come into play, how acidic the environment is. So if something's coated, it won't be absorbed in the stomach, it absorbs later, so then there's going to be less abuse with that. Really the most common or the highlighted routes of abuse, misuse, whatever we want to call it, really comes down to either oral, so taking more of the pills or chewing them and whatnot, then nasal, so intranasal, so it would be crushing it and then snorting it, or intravenous use injection. All of those not being the typical route, the expected route, what we want these medications to do and how they should be taken. People will venture down the route of each of those, to get more of the effects, whether it's more pain relief, euphoria, getting high, whatever it is, regardless of the reason, those are the routes that are utilized. When it comes to the abuse deterrent formulation, opioid medications or ADFs, really the big idea here is thinking about, I always preach with our professional students of SMART goals. The intention here is not to be the panacea of this is going to take care of everything. Even with the future of the technologies that are coming out, multi-pill abuse resistance and whatnot, other formulations of ADFs, the goal is to prevent the transgression of somebody going to injection, snorting, and whatnot. That is one tool in the overall toolbox for risk reduction, both patient risk reduction and professional risk reduction as well.